Welcome to Closely Prescribed. Today we're going to talk about alcohol and some things to consider when you're drinking it and some other things that you may not have known about it. I'm Robert.
I'm Joseph. I don't have any. I have water.
Could be vodka.
I'm Ben.
I'm Elliot.
Alrighty. Please stay tuned so we can actually have this interesting discussion. Tell me about it. What do y'all know? What are some considerations? What should people know?
So alcohol can be toxic in excess. It breaks down by alcohol dehydrogenase into aldehydes and NADH.
And that's like a big problem with the liver. I know it causes, like when you have excess NADPH and aldehydes, it can cause these lipid deposits to take place in the liver, and this is kind of what leads to what they call alcoholic hepatitis and ultimately cirrhosis, which and we hear about all the things that occur in the body with alcohol, and definitely the liver is one of the things that's mainly affected.
No, there's not really a cure for that, right? Like you, if you get it, hopefully your liver regenerates and it can actually function from actually its regeneration, but we don't have like a drug to give you.
Yeah. I mean, like the liver is really resilient. It's one that regenerates really well in our bodies. And so basically the cure is stopping drinking alcohol. So.
Right. That makes sense. But if you stop drinking alcohol, that means your liver will go back to normal, right?
There's a threshold because ultimately if you're so cirrhotic that you have, fibrosis tissue in your liver and stuff like that, that's kind of irreversible. But but if you're in the earlier stages and you stop, your liver will ultimately go back to normal. So,
which is good.
Yeah.
What were you gonna say?
And this generally happens when you have alcohol high intake of
you
alcohol.
booze too much.
When you intake alcohol way too often, that's the issue. So everything in moderation is fine. You can be drinking 1 cup of wine every day for the next 50 years and be all right. But it's when you do 3, 4, 5 cups of wine, or we really like our liquors in the U.S. and it's the most efficient way to get that buzz. So that's what the majority of alcoholics do. Is they go to these hard liquors eventually, and then they have to get to a certain level of buzz or whatever, and then they end up destroying their liver. And we have that ability to repair our liver, but with that constant attack with the aldehydes and the NADH, it just ravages everything, and your liver becomes fibrotic, and you end up getting portal hypertension, which is a common issue with fibrosis, which is cirrhosis of the liver, and it just ends up you can get a lot of issues with portal hypertension.
How familiar are you with Four Locos?
Four Locos? Not at all.
What is that?
It's
well,
I was gonna say it's just these. Are they liters?
They're huge. Don't ever get them.
They're huge cans. I mean, originally they were like Red Bull or some sort of energy drink mixed with wine, pretty much, or something like that.
Yeah.
But anyways, they have 12% alcohol in them, which is the equivalent of what wine is, and it just goes down really easily. So you can kind of just binge drink them and get really drunk.
Yeah.
So drinking alcohol, I mean, depending on what you're drinking, if you're doing wine or if you're doing moonshine, there are different levels of the type of alcoholic beverage you can drink.
Yeah, proofing.
Yeah. So what is the proofing?
Proofing? I'm not 100% certain, but I think the highest you can legally get in the United States is 100, and I think that's Everclear. Everclear might be 90 proof though. I'm not 100% certain about that.
Right. Okay. So the proofing, from what I know, is that the percentage of alcohol, I think, is double the number, which is the proof.
That's what I heard.
So if you're the highest you can get is 200 proof, which is 100% alcohol. Right? So you're not going to drink that. You shouldn't drink that.
No.
But I know that
people
it's not
do.
People do.
Really?
So even if you're not going to get liver disease, I mean, you can get other types of diseases like esophageal diseases, where drinking alcohol can cause problems such as gastric esophageal diseases.
Mallory Weiss.
Right. Or even leads to what we call Barrett's esophagus, where you start to change the lining of your esophagus. And when your body starts to adapt to new environments, and drinking alcohol is a new environment. When your body starts to adapt, you get a change in your cell type, and that generally leads you down to a process of cancer. So, sure, things in moderation can be helpful, but again, taking things prolonged over time, your body is going to adjust. And sometimes that adjustment is not helpful. Sometimes that adjustment can be dangerous, because if it doesn't adjust the right way, you can get complications such as like cancer.
I guess where do we draw the line of like moderation? It's kind of interesting when we do like our clinical cases and we do go through the scenarios and they're kind of pointing you towards, okay, this problem is related to alcohol.
Yeah.
And then you get to your questions where you're like, okay, how much do you drink? And they say like, you know, I drink a handle of vodka.
Oh, no. What kind of Russian would do that?
Yeah.
So obviously that is not in moderation, and that's like a clear alcohol, like this person is suffering from an alcoholic disorder.
Mm-hmm. Yeah. I think it's kind of difficult too right now because the DSM-5 has a bunch of different classifications for like addiction, abuse, blah, blah, blah. And that you have to go and I think interview people and actually figure out exactly where they are on that scale.
Yeah.
Yeah, that's important. We have what is the screening tool that we use to gauge someone's ability to, stop drinking, or if they have gone too
Self-control?
far past? Yeah, self-control with drinking alcohol.
So it's called CAGE.
Okay.
So it's are you conscious of how much you're drinking?
Mm-hmm.
Do you see this as an issue? Like, do you ever use alcohol as an eye-opener?
Mm-hmm.
Do you ever feel guilty about your consumption of alcohol?
Mm-hmm.
Do you forget things, stuff like that?
Mm-hmm.
But generally, with alcohol use disorder, there's generally like an underlying issue that needs to be like addressed before you can really go ahead and treat the alcohol abuse disorder.
Yeah, I was listening to another podcast, and they were talking about women. Now, because of the pandemic, that there's a 30% increase in women who are coming in and being admitted for alcoholic liver disease or severe cirrhosis nationally. Yeah, and it's a problem because, again, you don't have a way to cure these people. You just have to hope that stop drinking and your liver bounces back. But if it doesn't, you're going to be at a deficit for a long time. And your liver does so much.
Yeah.
And if it's not working, ultimately, so many things are out of whack. So I just think that it's just not something that... Generally, I think the media says that guys drink, right? And we're the only ones that drink, and we're the ones that have the drinking problem.
TikTok.
Right, but I mean, this is something that's affecting both men and women, dealing with underlying issues, emotional or social, cultural problems that the escape that we chose in our society is drinking. Another podcast I was listening to talked about in women's suffrage, the fight for the ability to handle things on their own and to have some responsibility of, inheritance and assets and things like that, because alcohol was running rapid during the early women's suffrage movement. I do know that it was an issue that women had to face because a lot of men were drinking a lot because of the other issues that they were dealing with socially. And so that kind of spurred a movement to make a constitutional amendment to outlaw alcohol. And we know how well that went, where we have to make another amendment to make it legal again. So we as a society have decided that alcohol is okay. And this is one of the mind-altering drugs that it's okay with us. And we've learned to manage it in medicine, where we see it all the time in our classes and in cases. So, I mean, what are you guys' thoughts about just like alcohol in just general? Do you think that it's a good thing for our society and a bad thing? I don't know.
I mean, I think like Ilya said, it's kind of cliche to say like everything within moderation can be like not harmful, and I guess like a beer can be a good way to relax, and we don't know how does that like affect mental health or giving that sort of like escape, or I don't know. I guess like I kind of agree that in moderation these things like don't have to be harmful, but obviously like when used in excess can cause some real problems.
Yeah I guess I can understand that. Life is not easy for a lot of people, right? And so we cope in different ways.
Yeah.
And this is a coping mechanism that I think a lot of people use recreationally. So I don't know.
I guess not trying to like promote it being like an escape mechanism. It's just like a good way to like go relax. Like I can't deny that I go enjoy like having a beer every now and then. And
right.
Like I don't think that affects my health.
Yeah.
Okay.
I think the other thing is too, like when you're younger, which most people start drinking, I would think in the United States, a little bit under the age range. But when you're younger, obviously your liver's going to be able to process it a lot better, and it's not going to be that bad. But then when you get older, you're going to get older, and it's going to be worse. Yeah, you're going to cut the part out about underage.
So the issue with underage drinking is that it causes a lot of brain damage, and the majority of patients that drink when they're younger, they do it in excess. They binge drink, so that means that if you're a woman, you drink more than 4 drinks at a time in one sitting, or if you're a man, you drink more than 5. So if you're at a college party, you're most likely going to be indulging in the alcohol. So your brain between the age of 16 to 25 is really trying to develop and trying to make you the person you are, and you have all those neuronal connections in your frontal lobe, so it really like hinders all that progress that your body's trying to do with the toxicity of the aldehydes. So that's an issue with underage drinking. We really want to see like people start drinking later on, but with our society and the world that is as it is, the legal drinking age in most countries is 18. In Canada it's 19, in America it's 21, but even with that limit, it doesn't mean that people don't have access to alcohol.
Right. In Scandinavia, it's even younger than 18, right? Yeah. In Scandinavia? Scandinavia?
No, I think it's 15, isn't it?
Yeah, I think it's that's an interesting way to kind of look at that.
But it's also, I think it depends on the type of alcohol you're consuming in some countries, because you can be drinking beer at 18, but you might not be able to buy hard liquor until you're 20.
Makes sense.
So it all depends.
It does depend. Like I grew up from a conservative Christian environment, and just drinking was just bad all around, right? And so I did not grow up learning about proofs or proper amounts of drinking and things like that. And so I don't have that I guess that experiential knowledge with alcohol, seeing people as I've gotten older who do drink within my Christian circle was kind of interesting, because they started getting these experiences and started learning more about it, and I wasn't partaking, and so therefore I didn't have that information. So I definitely know that there are people who do come from cultures who just don't have experience or know much about like alcohol, what it can do to you, or whether it's good or bad, or whether it's a moral issue. Maybe it's not a moral issue to some, but it's an interesting conversation because there's so many different ways to look at it, right? But I think it's important to actually have that conversation and to address it head on. I don't know. You guys think, agree, disagree?
So I'm actually on the opposite end. I'm Croatian. I'm from the Eastern Europe. So we have a lot of alcohol in our culture, and it's actually a really big problem back home, and even higher now with the pandemic. I saw an article where there's even more issues going on with like domestic assaults and violence going on in the home, and then just like the increase in alcohol usage during the pandemic. But growing up, my family, they partake in alcohol, and but it's crazy to see like every single person has a different like response to alcohol. It's really crazy to like really envision. Like some people are angry drunks, some people are happy drunks. It really depends on the person and their personality. And just because they're an angry drunk doesn't mean that they're like an angry person per se.
Right.
Some people are very like lazy when they're drunk. Others are very like rambunctious and stuff. So it's really like depends on the person, and it also depends on what kind of alcohol they're partaking in. So some people react to different alcohols in different ways, which is really unique in itself, because maybe you drink a shot of Jaeger and you feel one way, and then you drink a shot of tequila and you feel another way. So
it just for like people who don't know, Jaeger is a lower alcohol content or higher alcohol content?
Not too much lower. It's like a 35% alcohol, whereas like tequila is like 40 or something.
All right, just for context.
And then it's really interesting. I don't know the exact reason that is, but I'm sure it has something to do with the chemical structure of all the stuff within.
There's definitely like when you talk about tequila, people always talk about how crazy your night is going to be.
Tequila makes your clothes come off.
Yeah.
There's definitely a weird culture around, or story around each alcohol and what it does to you.
And moonshine and all that.
That's illegal. I think the brown liquors tend to have a less alcohol content because there's more carbs in it still, so it's not all fermented, but then the clear stuff is just straight ethanol. I think that's how it works.
I'm not sure.
No, I don't know either.
This is called.
I am the least educated person about.
I thought the color of the liquor depended on, especially hard liquors, not like something like Jaeger, which is more of a liqueur kind of thing. I thought it had to do with the barreling process, where you have more of a smoke taste to it. So you would have that more of a amber color per
That's
se.
what happens when you brown alcohols? Yeah. I didn't know that. That's interesting.
So most alcohol comes out clear when you distill it, because it's a distilling process. However, when you barrel, put it in a barrel, or you age it, it catches that nice amber color.
That's interesting. Oh, I didn't know. All right. Well, we covered diseases, we covered culture, we've covered perspectives and different histories. Do you guys have anything else you want to add about maybe alcohol, or how it's affected you, or that how you've seen it, or something you learned about it?
I mean, I think it's just it's so prevalent in our society, and definitely can cause significant problems. I think just as physicians, we'll have to learn how to find a balance when we're working with our patients on how we educate them, and some patients not drinking alcohol is just not going to be an option. So how do you educate them on those sort of problems while keeping alcohol a part of their life still? And
that's good. I mean, if it's going to be here, we now need to learn how to deal with it.
Yeah,
I think the most important thing we can do is teach people how to be responsible when they consume alcohol. They really have to know themselves and their limits when it comes to alcohol. I feel like drinking and driving is a huge problem that we face here in the States, and probably worldwide, where alcohol is prevalent. And that causes a lot of issues, and there's a lot of car accidents, and
not until we get electric cars.
And people end up dying and losing their life because someone decided to not be responsible with their alcohol intake. And it's also very it can be very destructive on families. It can be very destructive personally. It can affect your health. Alcohol, it has its benefits. You can let loose. You can be sort of yourself in an environment that you're not comfortable in, in a friend group or something like that. But it has its drawbacks, and until society learns how to really embrace those impacts of alcohol, I feel like we're going to continue having a lot of issues with alcohol.
That's fair. That's pretty fair. Mm-hmm. All right. Well, thanks for those comments, guys. It was really enlightening. Hope you guys learned some things about us and maybe about the subject of alcohol. We will definitely revisit some more subjects like these in the future. But until then, please comment, and subscribe. And we will talk about other subjects on our next episode of Closely Prescribed. Till then, take care.
Have a good one.